Yes, so my name is Kate Askew. I'm a speech-language pathologist here at Essentia Health. I evaluate, treat, and work with patients who have any deficit in cognition, speech, language, or swallowing. I love it because I get to make a difference in people's lives every day. We have an interdisciplinary collaboration type of approach to our therapy here at Essentia. And so I see and work with all of the therapists right away, first thing in the morning. We get together, we discuss patients that we have that are similar in caseload, and decide what our day is going to look like by divvying up who is going to see what patients and determine priority based on that. So typically we'll attempt to evaluate people first based on any deficit that they have in some of those areas I said before. So any person who might not be swallowing appropriately or processing information or has had a stroke or a traumatic brain injury that leads them to having deficits in those areas. We will, first evaluate and then determine a treatment plan based on what those deficits are and what's individualized for those patients. So we, here in the hospital, with our speech and language portion, we do have some standardized tests and screeners that we use in the patient's room. A lot of times though, we see more of the technology come into play with our swallow patients. So we'll typically assess them first at the bedside to see, okay, what's going on with this patient? And based on what we see, we might have further needs that need to be seen, and we can do that typically under an endoscopic evaluation or a fluoroscopy. So down in radiology, we can do some x-ray with our swallow too. So we collaborate a lot with the radiology department as well. So when people have deficits in swallowing, we call that dysphagia, so any trouble swallowing whatsoever. And we determine based on what their symptoms are, what kind of diet to put them on. We can modify foods, we can modify liquids, we can modify our position, even how we're just sitting in a chair, to make sure that a patient is swallowing safely. Because if a patient isn't swallowing safely and food and liquid is going into the airway, that can cause a potentially life-threatening pneumonia, which obviously we'd like to avoid. So we provide rehabilitation in those muscles, as well as modification in their diets to ensure that everything they're eating and drinking is going down appropriately. So I have a cousin who is a speech pathologist. She kind of mentored me a little bit. I took an aptitude test in college that it was on there as well, so I figured I'd give it a shot, and I really developed a passion for it when I was in graduate school. So for this program, you need to not only do an undergrad, but you have to have a master's degree to be a formal speech pathologist. They cover a wide variety. We have a very large scope of practice. So this is actually my third job. I worked first outpatient, then in the schools, now I'm here in the hospital. So kind of covering all my bases first to figure out what I want to do when I grow up, and landed on this right now. So you learn a lot in school, but you learn much more on the job. I definitely find that when I'm immersed in a career, I do as much as I can to learn everything, and every day you're seeing something new here, so you just have to continue up with that research and education. Volunteering is always a good opportunity, just shadowing and volunteering to see, okay, what's a day in the life of an SLP? You can try it, on an outpatient level, or like I said, the hospital, schools, just to kind of get an idea of what's going on. See if that's something you're interested in. Maybe take a couple courses in an undergraduate program within it, determine, based on that, if that's something you'd be interested in. It is a lot of work though, and you kind of have to have a big passion for it if you want to get through the full program, I would say. I'm very interested in it. I've got a great attitude, and I'm very flexible. With this field, you have to have that ability to be like, okay, this is my plan, and then throwing that plan out the window as soon as you go in there because they might not be where you thought they were. So being able to be flexible really helps make the day go by and helps you be the best you can to give this patient what they need.